COVID-19 cases are on the rise in most of the province despite an 85% vaccination rate. I'm Cristina Howorun, and today the Ontario Science Advisory Table released its latest projections. The good news, case numbers are declining in places like Peel Region. Hospitalization and ICU rates are stable. The bad news, that could change very quickly. Case counts are up. Today, there are 598 across the province, and the 7-day rolling average is up by 125, standing at 537.
I don't think there was ever any doubt that as we did things like open restaurants at full capacity and open stadiums at full capacity and really telegraphed to the public, I think probably more than we should have, that we're safe, that everything's fine. These steps were going to lead to an increase in cases.
A spokesperson for the Minister of Health tells CityNews today's modeling supports Ontario's gradual plan for reopening, which includes the government's recent decision to pause the lifting of capacity limits in remaining high-risk settings to ensure the province has time to better understand any potential impact on hospitalizations and ICU admissions. The modeling shows that hospitalizations and ICU capacity has remained stable, but warns that could change quickly.
Hospitalizations and ICU admissions always lag a rise in cases. They always do. People have to get sick, then they have to get very sick, then they have to seek medical attention, and then that has to get counted and reported. As far as we can see, everywhere we look, there is no decoupling between number of cases and hospitalizations. Just wait 2 or 3 weeks and you will see hospitalizations and then ICU admissions start to rise.
There are currently 130 patients in Ontario's ICU beds. The table predicts that number could climb to 200 by January. Furness blames the government for lifting capacity limits at stadiums and other locations too quickly.
The pandemic is not over yet. We could still have the very messy time of it. We need to be smart. And that's it. We don't need to lock down. We don't need to shutter businesses. We just need to be not dumb. We need to wear masks. We need to check back status. We need to avoid giant gatherings. It's fairly simple what needs to be done.
Last month, the government announced it would be lifting all COVID restrictions, including mandatory masks, by March. But that will only happen if case counts, vaccination rates, and other COVID indicators allow. The latest report shows that people who have lower incomes, identify as minorities, or who are essential workers remain the highest at risk.